Now I'm really pleased to introduce my good friend, Professor Robert Knight. Bob is a leading neuroscientist. He works and teaches at UC Berkeley. His research involves studying the function of different parts of the human brain. He will speak about the unique effect music has on and in the brain. Thank you, Bob.
Well, thank you very much, Joanna, and thank you for asking me to participate in this. It's just one of the most wonderful organizations I've had the pleasure to be engaged in. So I'm going to talk about three things. I'm not very long, but three things about music that I find important, and it speaks to the generalizability of music across cultures and the power of music and the power to be different than speech. And the first thing I'm going to talk about is that I did a study about 10 or 12 years ago. And before telling you the study, I would need to tell you there's a brain system that if you're listening to, let's say, a stream of sound and you expect something to happen and it doesn't happen, you get an automatic brain response, an orienting response. So you can say, whoa, what just went wrong? So a very talented grad student who's now a professor at Northeastern, Psyche Louie, she's a professor studying music neuroscience, did a study where she took people and had them listen to Western music of the kind you're all aware of. And she recorded their brain electrical activity. And then she again presented the same music to them, but made just little changes, maybe the wrong note or the wrong chord. And voila, just as expected, you get this automatic brain response that says, hey, something didn't work. But then what she did, really, she's very clever. She used a music system I'd never heard of. It's the Boland-Pierce scale, which I don't know much about it other than it's 3-to-1 chords, and but it sounds strange. It sounds like this. You've never heard it before. People hadn't heard it before. So what she did with the subjects, recording their brainwaves, she had them listen to the normal chords and progressions of this basically Boland-Pierce scale, and for half an hour. And then she replayed it, but made just little changes, just like in the Western music, and voila. You, in half an hour, assimilated this new music scale, and your brain detected when it wasn't playing correctly. Really, quite amazing, proving that your brain really wants to perceive and understand music. It's just a powerful drive on many levels. So the second thing I'll just discuss very briefly is we've been working for about a dozen years trying to develop a implantable speech decoder. So what does that mean? Well, as you all know, there are many patients who can't speak. It could be from a stroke. It could be from Lou Gehrig's disease. It could be some very severe developmental abnormalities. The thoughts may be in your head, but you can't speak. So there's been a drive to develop a way to decode your thoughts, what you want to say. And the way we do this is there's people with uncontrolled epilepsy sometimes need to have surgery, and we need to find where their epileptic activity is so that the surgeon can basically treat them and hopefully get a cure or now a control with medications. And we've done a lot of the work with speech, and that starting, as I said, about a dozen years ago, which is really being pursued heavily at UCSF in Eddie Chang's group. We decided to do the same thing for music to see if we could reconstruct from your direct brain recordings and play back what you heard. The first step of decoding, actually, if you were thinking about a particular rhythm. And we actually recorded from 29 patients being evaluated in the hospital for epilepsy surgery. We recorded for them Another Brick in the Wall by Pink Floyd. And we let them pick. Actually, they could pick anything they wanted to hear, but a lot of them picked Pink Floyd. So we had this 4-minute sequence, this 4-minute, Another Brick in the Wall. And actually, we were able to take the actual physiology, the electrical activity of these electrodes sitting on auditory regions known to be involved in music perception, and reconstruct the song. And it's actually quite amazing. The paper's now in review, and maybe next year, I'll actually play you Pink Floyd played from your brain. You say, why do that? Well, first, it's interesting, but also music adds prosody. and it's affect. So instead of having maybe decoding what someone wants to say, I love you, maybe if we know more about the organization of music, we could use some of those electrodes to produce I love you, something that has more affect in it. So that's the goal. And the last thing I'm going to talk to you about again very briefly is a clinical phenomena that I'm sure Titia knows about, and certainly Joanna knows about, and any clinicians. It's been known for about roughly 100 years that patients with aphasia, particularly Broca's aphasia, which means they really have trouble speaking. They can understand what's going on, but they have trouble outputting speech. A subgroup, up to maybe even half these patients, can actually sing, which is when you see the phenomenon, you go, what? But it has always been felt that what they can sing are overlearned things. For instance, happy birthday. But the question is, what we wanted to know, and I'll tell you after you hear the patient in a minute, we wanted to know what's the neural organization of singing versus speaking, because if we could figure that out, we could maybe develop new interventions. So maybe, Titi, if we could hear the first patient has a left frontal infarct, and he has a very pronounced Broca's aphasia. You're going to hear him sing and then try to speak happy birthday. So could we play the tape?
Not nearby.
Not nearby.
Yeah.
Not nearby.
Yeah.
So you must have been, let's try happy birthday. Okay, ready? With me, ready?
Happy birthday to you. Happy birthday to you. Happy birthday, dear Stephen.
He's one of your research subjects. He can sing, right?
Yeah.
This is he basically can sing, and he has
The
now say the words.
No, that chance. Happy birthday to.
There's your signature patient.
Yeah.
And the C
You should sing in the beat counter. Yeah.
Why don't you try that?
Yeah.
I like some sausage. How about a pork loin? Can you sing? Can I hear you sing?
I like some swordfish.
Wow.
There you go. I don't think you need sophisticated statistics to realize this is a very powerful phenomena. So it's quite clear there are things that overlap in terms of brain organization for singing and for speaking, but there's certainly obviously other areas that allow you to sing but not speak. And most importantly, just from that by the way, that gentleman is super nice. They're both extremely nice, as are pretty much most patients, but he's a gourmet cook, and he was very frustrated about not being able to go to the meat counter and order whatever he wanted. That's where we did that little piece on him basically singing, which then that little snippet proves it's not just overlearned speech like happy birthday. It actually could be any speech. So if we can unpack what's going on, it might lead to new interventions to help people who can't speak. And I'll close with just saying what we're doing right now. We have a very large cohort of aphasic patients with my colleague Nina Dronkers, and we have them segregated as patients who can sing and patients who can't sing. And we're studying both their spontaneous, their singing of things they have heard, and new singing. But importantly, we're trying to see what's the different anatomy in the brain, what's left, what's not damaged in the patients who can sing, as opposed to the ones who can't speak and can't sing. And in parallel, my lab, which does intracranial recording, we actually have patients who are being evaluated for epilepsy, who are either singing overlearned phrases or singing phrases they've never heard, and likewise speaking them. And we want to be able to dissect out the physiology of singing. And hopefully that basic knowledge will lead to something that might help the kind of patients that your organization so wonderfully takes care of. So I will turn it back to my good friend and long-term colleague, Joanna.
Thank you, Bob, so much. Your explanation of what happens in the brain, or what we think happens in the brain, definitely helps understand the relationship that Maya, who was my daughter, had to music. For those who didn't know my daughter, She was a nonverbal, severely disabled girl. Despite that, she was able to express pleasure when she had access to music. She always made joyful sounds when there was singing and music. Despite her severe disability, she tried to strum the guitar or bang on a drum. She definitely had favorite songs and squealed and laughed when those were played. So after she died at age 14, her dad and I felt that the best way to memorialize her was to create a program in which people like her could have access to music therapy services. Maya was a very outgoing person. And after her death, she had been able to influence so many people's lives. And that is very meaningful to all of us.